Welcome back, dear viewers. Definitely, I just want to, bring to your attention that today they will test the sirens in the whole state of Kuwait. So please don't panic and stay put. And this is only testing, so there's nothing happening. They are testing the sirens. I repeat, siren testing today by the entities of the government of the state of Kuwait. Anyway, and definitely our guest today is a consultant pediatrician specializing in pediatric cardiology and interventional cardiac catheterization with extensive experience in diagnosing and treating heart conditions in infants and children. He is a forefront of advanced minimally invasive cardiac care, helping young patients achieve better health outcomes through early diagnosis and modern treatment techniques. We are pleased and proud to have with us today Dr. Adnan Alhadlaq, consultant pediatric cardiology and interventional cardiology. It's really a pleasure to have you, and good morning, Kuwait, Dr. Adnan.
My pleasure. The pleasure is mine. Thank you very much for having me.
Doctor, first of all, could you briefly explain what pediatric cardiology is and how it differs from adult cardiology?
So basically, pediatric cardiology is the science of diseases and treatment of heart disease in children.
Okay.
The cutoff usually for children is up to 18 years. Sometimes we extend it up to 21 years of age, while adult cardiology is what takes over from above 21 until the end of their life. So we start from the beginning of their life till 18, 21 years, and adult cardiology takes off from that point. But the differences between pediatric cardiology and adult cardiology are fundamental. The differences between the two medical schools are based on the expectation and the disease itself. So in adult cardiology is a wear and tear medicine, meaning the heart gets tired, the valves get damaged, the coronaries get clogged, the muscle gets weak, and other problems that they can face, such as infections. Pediatric cardiology is different. The diseases we are treating are diseases that are made from the beginning. So they are congenitals, meaning that the child is born with that defect.
Default.
So either they have holes in the heart, problems with the valve. So the valve itself is not. It's not because of the use it got damaged. No, it got damaged.
Completed, maybe.
It got damaged, or it's not malfunctioning because it was not being created or formed in a proper way, or placed in a proper position. Things may be shifting around. Arteries may be coming from a different areas or reaching a wrong destination.
I see.
And all these things make it fundamentally different. We also are heavily invested in genetics. So lots of these diseases are related to genetic disorders. So during the formation of the heart, the genes themselves play a major role in how the heart forms and how the heart shapes. There are also different diseases for children, lots of them related to viral infections, and very little of them are related to any cholesterol or high blood pressure or the other diseases that affect the adults.
Amazing, well said, definitely. So it comes, maybe genetic defect or something like that. So what are the most common heart conditions seen in children today?
By far, the most common congenital heart disease or disease seen in children are defects in the septum. So these are either ventricular septal defect or atrial septal defect. So the heart has 4 chambers. Two of them we call atrium. Just like an atrium where you receive people, that receives blood and stores it and prepares it to go to the ventricle. The ventricle itself is the pump. That's what pumps the blood. So there should be a wall, a septum between them, separating the blood coming back from the body with no oxygen from the blood coming back from the lungs, full of oxygen, ready to be delivered. So any defect in these septations is what we call septal defect, either atrial or ventricular. And by far, they are the most common ones.
And many parents hear the term congenital heart disease. Definitely medical terms.
Yes.
Yeah, and terminologies. So what does it mean in simple terms?
Well, it took me years to say that correctly also.
That's a good point, doctor.
But because I use it frequently,
yeah.
Congenital simply means present since birth. That's the definition of it.
Okay, present since birth.
Yes.
Okay.
In reality,
Amazing.
In reality, it is a defect during processing. Do you know how the heart forms? It's a very fascinating organ. The heart starts as a simple tube. Cells align and make a channel. And this tube just keeps growing and folding and folding and folding and septating. And in between starts creating valves.
Okay.
So just understanding how the heart turns from simple cells that are forming a tube and folding in the perfect angles, perfect directions, and septating.
Subhanallah, this is
amazing. It's really a miracle.
Yeah.
And one of the fascinating things that we learn in our life, understanding that helps us understand where problems happen, how does the defects occur, and it makes us understand how to treat these patients better.
That's really amazing. It's well said, you know, because honestly, I had no clue whatsoever about, you know, how this beautiful organic system, you know, works and started. But this is really amazing. And how early can heart problems be detected in children, and what are the warning signs parents should look out for them?
With advanced technology, we are able to detect heart disease as early as 3 months of fetal life. So when the baby is in the mother's belly. But the problem with detecting problems when the baby is in the mother's belly, it has a high margin of error, meaning you may miss simple things or smaller or medium defects.
It gives you wrong diagnosis.
Yeah, because you're still looking at a very tiny creature inside them, and that you're looking only at a very small heart. So it's really difficult to understand if there is really a defect or not. But attempts have been, you may be able to detect as early as 3 months, but that's the extreme. Most of them were detected at about midway half through pregnancy. So maybe at 6-7 months. About 18 to 22 weeks, that's the correct time that we are detecting most of them. But the accurate diagnosis only comes after birth, when the child is born and gets examined. And the way we examine him is by clinically checking the child, checking the oxygen, listening to the heart. And by doing that, we screen the children for any defect. And then for those who need, we will do what we call echocardiography. Echocardiography is the application of wave sound to the heart, which creates an image of the heart. And we have a dynamic image. We see the heart moving, we see the blood flowing, and we understand how the heart is formed and if there was any defect in it.
That's definitely amazing. And we always, you know, as you know, people we see on reports, social media platforms, that some cardiologists perform surgeries on the infant inside the belly of his mother. That's amazing, you know.
Yeah.
I don't know. So definitely you came across that.
This technology is being used, but its use is very limited now. We're using it at desperate cases where the outcomes are really bad, and trying to improve the chances of the fetus to live or survive after being born. There are two ways of doing it. There is heart surgery, And even now, we started doing cardiac catheterization on the babies in the mother's belly. Now, simply.
So you can perform cardiac catheterization on the infant.
Actually, that's what is most taking off these days.
Okay.
Because it is less invasive, while surgery would require you to open even the womb itself and go to the belly, the child's heart to perform your procedure. Cardiac catheterization, you'd be able to do it without doing that, but you still have to go through, but in a smaller, more minute incision.
Amazing. So what is the interventional cardiac catheterization, and how does it help treat heart conditions in children without open heart surgery? So this is how you put the tube.
So cardiac catheterization, I like to use an analogy of plumbing.
Plumbing, okay. Amazing,
So
that's easier for us.
Let's imagine the body having lots of pipes.
Okay.
That is arteries and veins. And the pipes are hollow in the middle, and they are full with blood. Just like pipes are full with water. So what we do is we puncture the artery or the vein, and we put special equipment called sheath that would allow to have a hole, access inside,
inside those pipes,
with a valve at the end that prevents blood from
coming out.
So you're able to go in and come out without. Now imagine if you have small straws, very thin, hollow tubes with different shapes. Some of them are at 90 degrees, some of them are straight, some of them at 180 degrees, and having wires. So you put the wires and you put the catheters and you guide yourself and move around the heart. The way you see what's happening inside is through X-ray. So you put an X-ray
inside,
that is live,
and you see where the wire is going.
You see where you're going, and you try to flow with the blood.
Amazing.
And you inject dye, which flies with the blood, and then you would be able to see.
Gives you another color.
Yes.
Maybe.
And by doing that, you're able to navigate through the heart, through the valves, through the arteries and veins, and detect disease. You're able to take samples of blood to measure saturations, to measure pressure, and perform diagnostic studies. Now, intervention takes it to the next limit. So we've talked about how we are taking the pressures and measuring the samples. Intervention, now you would need to do something to the heart. The first procedure that was done was balloon septostomy. So it's opening a hole in the heart to allow blood to mix in certain type of diseases that was fatal after birth if not treated. So what the doctor did is, where the blood with oxygen was getting trapped, they went through and they put a balloon and they opened that septum. Now blood was mixing and the baby survived and had a better life outcome. So that's the first one. And from there, we started taking it further and further to dilate valves. So if we have a valve that is narrow, we will dilate it with a balloon. We also started doing other stuff. So now we are placing stents. So if an artery or an area is narrow, we put a stent over there and widen the artery or the vein. Recently, we started also closing holes in the heart. So by placing a plug. So these are smart type of metals we call nitinol. So you can imagine if you take a metal and bend it, it will stay bent. But imagine if you shape it as a tube, but then if you leave it, it goes and remembers how it was created at the beginning. So you'd be able to push it through the small straw and place it where the defect is, and that metal will form and hold the hole and close it. And by that, you've closed a hole in the heart that could be as big as the circle in my hand here, without having an incision in the chest without anyone knowing that he had a heart surgery. Finally, we are able now to implant valves in the heart. So you have a faulty valve, you need a valve, we'll be able to implant the valve in your heart without having open heart surgery.
Actually,
and this is very amazing.
You know what a beautiful technology, you know, and science when they, you know, gathered and in the medical, you know, sector. Definitely, it's amazing. So, which pediatric heart condition can be treated successfully using catheter-based procedures, which is you just talked about?
Yes. So we'll start with the valves. The most common valves that we are treating are the pulmonary valve. This is the valve that guards the blood going from the heart to the lungs.
In Arabic, we call it aortic?
Pulmonary.
Pulmonary.
Yes. The aortic one is the next one. That is the aortic valve. It guards the blood going from the left ventricle or the left side of the heart to the body. These valves can be affected by narrowing. So these are adhesions that happen during the formation of the heart that needs to be released. So what we do is we put a balloon in that area and we inflate it, and then we open the valve up, and then blood can flow more easily. The other thing is any narrowing in arteries, we're able to dilate it and place a stent in there. Any holes in the heart, or some holes in the heart, we are able to put a plug and close it.
Doctor, I wanted to ask you about those stents. For what their ages?
So,
for how long they stay?
So they stay mostly for their life.
Yeah, I know, but if are they adequate enough, you know, for 15 years, for example, and after that, what happens?
So it's very
say the lifespan of that.
The lifespan of the stent is a lifelong. We don't change them.
Okay.
Yes, but it's very important to know who and where are you placing the stent, because the stent, the child is amazingly grow.
Absolutely.
And these metal, they do not grow with the children.
Exactly.
So we do choose and very careful with where, what, and whom, and where we place a stent.
Because definitely that artery will be bigger, and that stent will be smaller.
So we avoid placing stents in small babies.
Okay.
But once they are a certain age, we're able to place a stent. Now, I may be able to place a stent in a certain size, let's say a 5 or 7 millimeter. But then I would follow you up in a few years, and then I would dilate that stent further. So I would put a balloon and make it bigger by pushing the edges of it and allowing it to grow as much as you need. But you have to be careful in what and where you use them, and their experience and putting the patient's best interest ahead is very important.
That's amazing. I don't know, I have plenty of questions, but unfortunately we are really out of time, Doctor. Any last message you would like to convey to our...
you know, I would like to convey a message that we have went from palliating and only comfort care for babies with heart disease into treating all types of heart diseases. And I would like to remind family that congenital heart disease, a problem in the heart, is the most common problem that happens in children after birth. Although it is not obvious like cleft lips or abnormalities in the body, it is present in the heart. Doctors usually would examine the heart, screen them, listen to the heart, and they would tell the families if there is a sound or if there is a need for an ultrasound. Also, families should be very aware of signs and symptoms of heart disease in babies and children. Any child who is not growing well, not gaining weight, having difficulty breathing, having blueness, they should be brought forward for examination, because early and timely treatment is essential in getting good results for them. And I wish everyone a healthy life for them and for their children.
Dr. Adnan Alhadlaq, thank you very much. Honestly, thanks for enlightening me and our viewers.
Thank you very much for having me. Thank you.
That was a great thanks and appreciation to our guest, Dr. Adnan Alhadlaq, consultant pediatric cardiology and interventional cardiology. Definitely we'll move on, dear viewers. Honey is one of nature's most remarkable foods, produced through an extraordinary process carried out by honey bees. The journey of honey begins in flowering plants and ends inside the bee hive, where bees work together with the remarkable precision and organizations. Honey is more than just a natural sweetener. It is the result of an extraordinary journey that begins with the flowers and ends inside the beehive through teamwork, precision, and nature's wisdom. Honeybees transform simple nectar into one of the world's most valued natural products. In this report, we take you inside the hive to discover how honey is made from flower to jar. So let's watch this following report.